Hey, good morning everyone. We're going to do a little video today looking after the hands, so just a short little one, and I'm going to stand up so you won't really be able to see my face, but hopefully you'll be able to see my hands pretty well. And this sort of thing can help relieve and prevent arthritis or slow down the progression. Also just increases the flexibility and functionality of our hands and fingers, okay? Right, so first thing we're going to do is just a little bit of a shake out, loosening the hands up a little bit, as floppy as possible, and then taking the pinky finger between the thumb and the forefinger and rolling that backwards and forwards. And you might be able to see, as I'm rolling that backwards and forwards, there's a bit of movement in this joint here where it joins on my hand as well. Yeah, so primarily we want to just be stretching, massaging this, and you'll see it changes colour a bit. Same with this one, and again, see how that finger is moving in this joint as well, side to side. Okay, if we can get that happening. If that doesn't happen while you do this, you can get your finger and you can kind of pull it, and you can do some little circles like this to get that little bit of motion in that joint, okay? But primarily this one is just massaging where the capillaries are the finest and it's the furthest from the heart. We're most likely to have blockages in our blood circulation. Also all the meridians end in the fingertips and the thumb tips, so if we can get them a little bit loosened up. And the thumb, I find if I have my thumb this way, it's much more likely to kind of relax and get a bit of movement in that joint than if I have it up this way, okay? So just getting that fairly relaxed. And again, if you need to, circling like this, each finger getting that movement, and often you have to get it into a relaxed position. If I'm tense, that won't circle at all. If I get it into a nice relaxed position, it can circle much more. The same with the thumb, getting it into that pretty relaxed position. Okay, and then massaging along from your wrist, along the blade of the hand, through your palm into your fingers, and again, you'll notice this changing the colour, so if there's any stagnated blood or energy there, it helps to pump that out, and any excess carbon dioxide that's accumulated because of poor circulation helps to be squished out. So I like to just do 3 times each finger, and right from the base of the hand all the way to the finger, and again just noticing that change of colour as it squashes out any old and stagnant blood. Bring the hand around this other side to do this one 3 times again, and then the thumb, and again if we can from back here, so it's kind of massaging this big muscly bit here a little bit as well. And just a little feeling also, as we're doing this, we're also sort of pulling, slightly lengthening the fingers. We're then going to separate our fingers out as wide apart as we can get them, and you'll see how wide that is. When I put my finger and thumb between here, I can get that much wider. So we stretch pinky finger, and these stretches only want to hold for about 5 seconds or so. They're quite small muscles. Stretching that one apart, stretching that one apart, stretching this one apart. Okay, and then we can get our pinky finger down, our ring finger up. I'll just pop down here a little bit. I'm going to push that one down and that one back, and do this fairly gently, and again you only want to hold for about 5 seconds because they're quite small muscles. Then pinky finger up, ring finger down, and you often get a bit of a burning feeling in the webbing as you do this one. And again you want to go fairly gently. You can make a stronger stretch as you have done it more often. Then ring finger up, middle finger down, and again by helping them out we get far more stretch into it than they can get by doing it themselves. I can feel a bit of burning in the webbing of the finger there. Ring finger down, middle finger up. Okay, and then middle finger down, pointer finger up, and again getting that stretch, and again I can feel a bit of a burning sensation in the webbing. Okay, then middle finger up, pointer finger down, and often it's the middle finger and pointer finger that are the most sort of tight and need the most stretching because we use them more and the muscles are bigger. Okay, and then again stretch that one apart. And if you then give this hand a bit of a jiggle and you give this one a bit of a jiggle, this one will feel softer and freer. If you have particular joints that have swelling around them, you can do a little bit of circling around and circling around and circling around and circling around. You can also, kind of have fingers on the back of the hand and here, and just find any sort of tender points and squash into them a little bit. Okay, and we want to do that with our other hand as well. So again, if we take the fingertip and again see if we can get that little bit of movement. If we can't, we can do this separate one to do the base of the finger. And again, you see how as I'm rolling that backwards and forwards here, squeezing here, it's also moving in this joint here. Okay, that's ideal if we can get that to happen. If not, and again this one you can see there's that little bit of it's moving a little bit side to side. Okay, so again we can grab that one and get it as relaxed as you can, loosen it up, loosen it up, loosen it up. And again that one really needs to be quite relaxed. I can feel that one's got quite a bit of tension in it, trying to find that spot where it's relaxed. And if one finger is more tight, it needs that little bit more attention than the others. Okay, same with this one, a little bit of this circle. Then from the base of the hand and the wrist, along the palm, into the fingertip 3 times for each finger. Again, noticing that squishing out any stale blood. And when the blood is stale and stagnant, it accumulates carbon dioxide, and when carbon dioxide is dissolved in a liquid like your blood, it forms carbonic acid, and carbonic acid attacks the joints and causes inflammation. So by just getting rid of that excess carbon dioxide and getting a bit more oxygen into the fingers can help prevent inflammation. We're then going to stretch them apart as wide as comfortable, and again you can see I can't get them all that far apart by themselves. When I help them, it gets quite wide apart. And again, only holding for about maximum 5-6 seconds. And then this one. And then pinky finger down, ring finger up. And again, I'm going to kind of get a bit of stretch there like that, but if I help that out by pushing that one down and pushing that one back, you get much more stretch into it. And then same for this next one. Pinky finger up, ring finger down. Ring finger up, middle finger down, ring finger down, middle finger up. Okay, middle finger down, pointer finger back. And again you might feel that sense of a bit of burning sensation in the webbing of the fingers. And then middle finger up, pointer finger down. And then thumb and forefinger apart. And again, if there's any particular joint that's particularly swollen, doing these little circles, we're circling around, little circle around, circling around, circling around, circling around. You can also do a bit of a thing where if you link your fingers together, you can then kind of stretch the palm open, and you can use your thumb to find tender spots. So you kind of poke in different, so there I'm poking in, I can feel that's kind of on the bone, then that's in the gap between the bones, then that's on the bone again, then that's in the gap between the bone, then that's on the bone, in the gap, and just doing that across here, and then a little bit further along the hand. Okay, and the spots that are quite tender, need a bit more massage. Okay, so you find those tender spots, you circle around on them, and anything you do for one hand That's always good to do for the other hand. So again, just finding where's the tender spots, and little circles is good for loosening things up. And if we think about where the biggest muscles are in the hand, biggest muscles are here, so getting a little bit of digging into that, but also digging into this area. And this point here they call the hergu point. We can dig into that a little bit. I've got my finger on one side, thumb on the other side, giving that a bit of a massage. And again, finger on the other side, massaging in here. And yeah, just a little bit of this, a little bit of a shake out. And if you do that regularly, it should help your hands to stay nice and healthy, nice and functional. Stimulates all the meridians that come into the hand, lung, large intestine, pericardium, heart, all that sort of stuff. So yeah, it's good to keep our hands working. So I hope that's been helpful, and yeah, I'll see you in the next video. And if you know anyone who's got hands and wants to look after them, send them a link to this, or let them know, or give the video a like or whatever. Okay, thanks.